Progress.
Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So since I last reported on June the 1st, just over 2 weeks ago, we've had an additional 237 cases. So that's over a 2-week period, taking us up to 12,172 cases. If we look week over week, we continue with a very strong downward trend in cases. So very much moving in the right direction. So for the week beginning the 6th of June, we had 94 cases. So that's down from 152 the week before. That's a 38% drop from that previous week. The province, too, has continued to come down as well, 32%. So we've come down a little bit more sharply than the province over the last week. And this is 9 weeks in a row in which we've had a downward trend of cases. So if we go back to when we had our highest number of cases in the third wave, that was a total of 716 cases back the week of April the 11th. And now we're down to 94 cases in the last week. So that's an 87% drop over a 2-month period, which is very good. We presently have 135 active cases. This is down from 303. And a total of 246 people have passed away from COVID-19 in Simcoe, Muskoka. So this is one case since I last reported, and for that matter, one case in the month of June. So this is a woman between the ages of 65 and 79 from Simcoe County, and I do express my condolences to family members of this woman for your loss. But certainly the fatality rate that we've been experiencing has come down dramatically over time. I would also say that we've not had any individuals pass away who were vaccinated, apart from those who had been received a single dose within 2 weeks of the onset of their symptoms. And so none of them have had the benefit of immunization. We've got 23 people in Simcoe, Muskoka, people who live here who are in hospital, either here or elsewhere. This is down from 26 when I last reported. And we have 10 in the intensive care unit, which is unchanged from when I last reported. And although case counts and new cases can drop fairly quickly like we're experiencing now, which of course is a very good thing, hospitalization takes longer to come down, and certainly the numbers of people in the intensive care unit takes longer to come down because typically they're in the intensive care unit or in hospital for a long time. Of the 23 people who are in hospital, 10 of them are under the age of 60. Of these 10, 6 of those are in the intensive care unit. And none of these individuals have been fully immunized or have had 2 doses of vaccination. We had 28 cases over the course of the weekend, less than 10 cases a day. We've had 9 cases in the last 24 hours. 7 of them are sporadic. 1 part of an outbreak in a congregate setting, 1 part of an institutional outbreak, which is out of our jurisdiction. 7 are male, 2 are female, 3/4 of them are under the age of 40. All of them are from Simcoe County. 3 of them were acquired in the community, which means we don't know exactly how they acquired them. 2 from close contact with cases, 1 part of the congregate outbreak, 1 part of the institutional outbreak, and 2 of them are under investigation. 8 of them are isolating at home, and 1 has recovered. As usual, the majority of our cases are in South Simcoe and Barrie, but we've had a dramatic drop in the incidence of cases per 100,000 population per week for all of our municipalities. All of them are under 30 cases per 100,000 population per week, which is, of course, excellent because throughout much of the third wave, we had a number of them well over 100 or even over 300 cases per 100,000 population. So it's very good to see it come down to such a low level. Oromadante has had the highest incidence of cases in the last week at 26 cases per 100,000 population. Innisfil is down to 19 cases per 100,000 population from 41 during the week of May 30th. Bradford, West Gwillimbury, 23 cases per 100,000 population versus 69 per 100,000 population in the week of May 30th. Barrie, 25 cases per 100,000 population, which is up very slightly from 21 during the week of May 30th. 21 cases per 100,000 population per week. Also, I would say that for our district as a whole, we have 15.5 cases per 100,000 population per week, compared with 25 cases per 100,000 population per week the week before May the 30th. And the provincial rate right now is 24 cases per 100,000 population per week. This is the first time that we've had cases, our incidence below 20 cases per 100,000 population per week since the week of November the 1st. Our variants of concern remain stable in terms of percent of our COVID cases that have been identified as variants of concern, so 87%, which is a good thing. And in particular, we're watching the Delta variant, B1617, and that is up slightly to 15 cases. Otherwise, it's very good to see stability with regards to that percent positivity figure. In terms of our outbreak, we're down to 6 outbreaks. We had 9 when I last reported. 3 of them are in congregate settings. 2 of them are in workplaces, so this is down by 6. We do have 2 new ones in a food and beverage location in Simcoe County and in a transportation and warehouse in Simcoe County. We have 1 outbreak in a community setting, which is new, an ambulatory healthcare service location, and none in educational settings. So there had been 1 in a childcare setting in Simcoe County that was declared over. In terms of vaccination, we continue to make progress in each. As time goes on, we get more and more vaccine from the province. So clearly, this is a very positive trend. And I will be speaking about some of the details of that a little bit later on with regards to how much we're getting right now. But as of the 15th of June, we have administered, together with our partners, 447,700 vaccine doses. So 62% of our population has received at least 1 dose of vaccination. This is our entire population, and 12% of our entire population has received 2 doses of immunization. That's 15% of adults, 18 and above, have received 2 doses of immunization. And 73% of adults have received their first dose, and 15% have received their second dose. Almost half of youth, 12 to 17 years of age, have received their first dose of immunization. So that's 48.5% of youth. So that is excellent, making very fast progress on that. Our dashboard that we've kept since last year is in yellow status, unchanged from when I last reported. Viral spread and containment at yellow status. laboratory testing at green status. That's in terms of the turnaround time and the percent positivity. Percent positivity is down to 2.1 from 3.8% when I last reported. Healthcare system capacity is in green status with regards to hospital occupancy and ICU occupancy, ventilated beds being occupied. And the public health system is in yellow. We're certainly doing well with regards to follow-up for new cases, and we continue to make improvement with regards to follow-up to the contacts of the cases. 81.1% of our contacts are reached within 24 hours. So at this point, I will turn to my media notes. With regards to vaccination rollout, we're having an excellent response from the population. Almost 3/4 of our adult population have come forward and received their first dose. And we're still making strong progress in people getting their first dose. We ultimately want a very high coverage rate. 90% would be really an ideal of the eligible population in order to achieve herd immunity. And we do ask that people come forward and book when you're eligible. You can receive it from our health unit via the provincial booking system. We have this information on our website as to exactly how you do that. We have many pharmacies that are participating in immunization and primary care. You, via our website or via the province, can see a listing of the pharmacies that are participating. There is AstraZeneca, Pfizer, and Moderna vaccine available through pharmacies. Moderna and AstraZeneca through primary care. Primary care offices reaching out to their own patients rather than asking that people would reach out to them. And this is also with regards to second dose immunization. We keep uploading new spots for people to receive their immunization. So I would recommend people have a close look on the province's website about that. As the volume of vaccine increases, so we're able to put in new slots for immunization. But we still ask if people could be patient about when exactly they would be able to book. And also a reminder for our clinics, for the, our mass vaccination clinics, once you're booked for one of those, you can each day connect on our website at 8 o'clock and put yourself onto the standby list for the possibility of being called up at the end of the day for any additional slots that remain from people who don't show up for immunization, for example, as a way of getting vaccines sooner. A little bit of information, a change with regards to AstraZeneca vaccine for second doses. The province recently shortened the interval for the second dose. So it had been 12 weeks, and this is based on the evidence about the effectiveness of the vaccine being greater if you wait to 12 weeks for your second dose. However, the province has indicated that people can book now as early as 8 weeks. So you have the option anywhere between 8, 12 weeks in that range. Certainly later than that, if you are later than that. The benefit of choosing 8 weeks would be that you're getting the additional protection of the second dose sooner rather than waiting out to 12 weeks. The trade-off is that the degree of vaccine effectiveness isn't quite as great at 8 weeks as it would be at 12 weeks. So that's an option for people. And in addition, those who received AstraZeneca vaccine can, as an option, choose Moderna or Pfizer vaccine, an mRNA vaccine, as a second option. So if you want to stick with AstraZeneca vaccine for your first dose, you really need to be checking in where you received it first, to a pharmacy or primary care, in that we don't carry it at our mass immunization clinics, the ones that you book online through the province. But if you instead want to receive Moderna or Pfizer, one of your options is to book through the provincial booking system for one of our clinics. The other options is through pharmacies or primary care. Primary care also carrying Moderna vaccine, and pharmacies either Moderna or Pfizer, depending on the pharmacy in question. So that's a number of options for people, I would say. Really, I think what's key is that people get their second dose. We do know that the Delta variant that is increasing in prevalence and we expect will become dominant as a strain really requires a second dose of immunization to be well protected. So hence the importance of even more so now for people to get their second dose. Another really important point is that we now can provide either of the mRNA vaccines as a follow-up for one of the mRNA vaccines. So if you receive Pfizer vaccine as a first dose, you can receive Moderna vaccine as a second dose. Or if you received Moderna vaccine as a first dose, you can receive Pfizer vaccine as a second dose. They are now viewed to be interchangeable. This is one of the recommendations that's come through from the National Advisory Committee on Immunizations. And we, this week, are receiving across the province a very large shipment of Moderna vaccine. And so we are now viewing our mass immunization clinics to be mRNA vaccine clinics, not necessarily Pfizer vaccine clinics or Moderna vaccine clinics. So if you're booking for your second dose at one of our mass immunization clinics, you would be receiving one or the other. And as I've indicated, they are interchangeable. They are both equally effective, both equally safe, and both regarded as interchangeable to the other. And this is actually normal practice for immunizations. This is the practice for hepatitis A and hepatitis B vaccination, tetanus, and meningitis vaccines. They all are viewed that way. And so this is really moving to more common practice for the management of vaccine now for COVID-19. And I would say that I'm now noting that not only am I a medical officer of health for Simcoe, Muskoka, but I am taking on the role of being the chair of the Council of Ontario Medical Officers of Health, and speaking in that role as well about the interchangeability of these two vaccines for second doses. I know that what I've spoken to is going to be fairly common practice across the province with other health units, given the large quantities of Moderna vaccine that are now coming forward. So this is really an important message for across the province. We continue providing immunization for those that are 12 to 17 years of age, and have this week and next week dedicated youth clinics that youth can sign up for. So we would more than welcome youth to participate in those clinics, pop-up clinics in various locations, certain schools. All of this bookable on the provincial website. Certainly youth can book any of the other sites that we have as well. It's just that these are additional opportunities for youth to get immunized. And we are making very good progress about that. Almost half of youth here have become immunized, but we certainly want that to continue to help create an even safer environment in the fall for our schools. We are certainly into the provincial roadmap, step one of the roadmap for opening up. And I am hopeful that we will be able to successfully continue to move through the roadmap through the summer and gain more freedoms for ourselves, businesses to be able to operate and a return to more normal living. That would be very good for us all. But we need to abide by the restrictions that are in place for each of the steps along the way. And at this point in time, That includes physical distancing and mask use outdoors when in close contact with people that you can't physically distance from, or certainly indoors in public spaces or workplaces. And also that there's a gathering limit of 10 people in outdoor places. So although you are able to get together with others, you still need to abide by that limit, and you still need the distancing from people that aren't part of your household. And also there remains really a prohibition on gathering indoors in private spaces such as your home. So in your home, you really need to stick to your household members, with the exception of individuals who live alone who can adopt one other household for that kind of close contact. And coming up in the steps to come, there will be the allowance for indoor gatherings as well, but at this point in time, they remain prohibited because of the safety requirements, the safe opening that we are pursuing. We have new information coming on our website about Socio Demographic information. This is with regards to immunizations. We have found a few things of note. One is that women have a higher vaccination coverage than men for most of the age groups. Also that for the adult population, 18 and above, people who live in neighborhoods with greater material deprivation are less likely to be immunized, a 10% reduction in immunization. We find a similar pattern for neighborhoods with more ethnocultural diversity, with the exception of the neighborhoods with the very highest degree of ethnocultural diversity, which very much are concentrated in Bradford, West Gwillimbury, in which case they actually have the same degree of coverage of immunization relative to neighborhoods with low ethnocultural diversity. And we are attributing that to the additional vaccination efforts we've made in that community as a designated hotspot. So that would be an example of a successful intervention. We, throughout the phases of the vaccine rollout, have been working closely with our Indigenous population in order to ensure that with them we're able to maximize opportunities for immunization for that population and for our First Nations communities. We are certainly aware that other racialized groups have had a much higher incidence of COVID-19 and may very well have a lower coverage of immunization. And we are working with leaders and representatives of those groups to see what we can to address their immunization needs. So I have a couple of questions from the media. As follows: why are larger municipalities like Peel able to accelerate their second dose vaccinations for almost every age group? Why isn't Simcoe, Muskoka doing the same? So the province has prioritized 7 health units, mostly in the GTA, although Porcupine Health Unit in the far north is one of those, to receive additional vaccine and to allow eligibility for second doses for all age groups in order to address the Delta variant. These are health units with a higher incidence of the Delta variant, the variant that has some immune escape, as we call it, where a second dose of vaccine is required for proper protection. And according to the COVID science table of the province and their mathematical projections, if the province does this, they can then reduce the amount of transmission of Delta that will happen not only in these locations, but elsewhere in the province, and have a significant impact on transmission and hospital admission rates. So while they are also providing large quantities of vaccine all across the province, there's additional vaccine going to these locations right now, and the eligibility is moved up in these locations. I support this approach. I believe the rationale is sound. I certainly look forward to us being able to open up eligibility. I have noted that the province has moved more quickly on eligibility all the way through their stages of the vaccine campaign than they've originally posted. So we may find that they move more quickly even now in the rest of the province on this. Is there any guidance on when individuals who are fully vaccinated can gather with others who are either fully or partially vaccinated without physical distancing or wearing a mask? So at this point in time, the province has not released any guidelines to this end. And so people who are fully immunized, and certainly those who are partially immunized, need to continue to follow all of the requirements and the recommendations that are in place for everybody. So not having other people over from out of your household into your home, apart from the incidence of individuals who live alone who would adopt one other household for that purpose, and limiting yourselves to 10 people for outdoor gathering with physical distancing from others who aren't part of the household, continuing to wear a mask when you are in indoor public spaces or work spaces. All of that remains in place at this time for everybody, regardless of their immunization status. I would anticipate that they will be coming from the province guidelines. It would speak to additional allowances for those who are fully immunized. I don't expect that for those who've only had one dose, but I do expect it coming from the province at some point in the future. So at this point, I'd be happy to take questions.
As always, thank you so much, Dr. Gardner, for your update. We are needing to end today's briefing promptly at 2:30, so we ask that you limit yourself to one question and one follow-up. And should your question not get answered today, please connect with me via the media inquiry desk after the briefing. We'll now start with Shane McDonald from Simcoe.com. Do you have a question for Dr. Gardner?
Yeah, sure. With the province and their public health indicators, we're at 70% with one dose of adults and approximately 18% with second dose in the province. I know you just said like in Simcoe, Muskoka, it's around 16%. I'm wondering if we moved into step one first early, would you support earlier move into step two? The 21 days number is still there. Do you think we should move beyond step one before 21 days, or do you still support that cautious timeline?
I support the cautious timeline. The reason being that an incubation period for COVID-19 is 14 days. Ideally, you typically go with 2 incubation periods. 21 days is 1.5 incubation periods. So 2 incubation periods would be 28 days in order to see any kind of surge that might arise from the changes that happened with the beginning of step one. You really need to be able to watch and make sure that we aren't beginning to lose control of things. And you still have Delta to manage as well, which is 50% more transmissible. We are seeing in the United Kingdom now a rise in transmission related to Delta, so we do need to be cautious.
And just 2 things, sorry. What is material deprivation, and what do you know about the Delta variant and how it spreads indoors? I hear that there's some research going on about that.
So material deprivation is a statistical phenomenon or definition referring to people's material wealth, essentially. What we'll do is follow up and provide you with the definition, the precise definition that our epidemiologists have been using. And as regards the Delta variant and its transmissibility, it is going to be more transmissible indoors, much more than outdoors, as is the case with COVID-19 in general. It's about 50% more transmissible than the Alpha variant, B117. That was the variant that was the real driver behind the third wave. So indoor exposure, regardless of the variant, but in particular with Delta, is very much of concern. Hence, the major changes that have occurred with step one of the roadmap are increases in outdoor amenities and freedoms outdoors much more than indoor.
Thanks.
Jessica Owen from Barrie Today, do you have a question?
I'll pass for now. Thank you.
Thanks, Jessica. Siobhan Morris from CTV Barrie, do you have a question today?
I do. Dr. Gardner, I'm wondering if you can talk the 15 cases of the Delta variant. What proportion of that, is that relative to the cases we've seen over the last, month and a half? And how many of those are active, if you know?
So I don't have before me how many are active. They've been occurring over the last 3 weeks or so. So I don't think what we're seeing is a dramatic increase over time. It's a relatively slow progression. And the other thing to be really looking at is what we call the percent positivity of variants, the percent of our variants that the percent of our COVID cases that are variants, because there isn't a screening test right now the Public Health Ontario laboratory uses to detect the Delta variant. They have to do whole genome sequencing, which is more intensive. They don't do it on all of the cases. And so there's a potential to miss some cases. So we also look at whether or not the percent of our COVID cases are due to variants of concern, whether or not that's actually dropping. If it were dropping, that would suggest perhaps there's an unmeasured portion of that is due to the Delta variant that we're not picking up, and that has not changed. So at the moment, I'm feeling somewhat reassured that we're not seeing a dramatic increase in these cases. And the other thing to look at is how many of these are related to travel versus locally acquired, and the great majority of them are related to travel.
And then I'm just wondering about you had your reassurance that Moderna and Pfizer are interchangeable in your words, but we've had reports elsewhere of people finding out they're getting Moderna at an appointment and turning around and leaving. Are you concerned about that and how it might affect our overall vaccination rate to get to the places we want to go?
I have heard of such a preference in some individuals, some people who've made that initial choice at least. So it's important, therefore, that people be aware and not be surprised by the potential that they would be receiving Moderna instead of Pfizer as a second dose at this time, and be reassured about their interchangeability. I think it's very important that people receive a second dose of immunization, that they do so as soon as they're eligible and able to do so, accept their booking and proceed. It's important for their health, the protection of them, their household members, family members, and others. And it certainly helps us all get to the level of coverage that we're going to need for herd immunity to help avoid future waves of COVID-19.
Can we go now to Brett Glover from Barrie 360? Do you have a question?
I do, thank you. And first up, congratulations, Doctor, on your new role as chair of the Medical Officers Council.
Thank you.
I'm curious, what danger is there in vaccine hesitancy at this stage, considering all the progress that's been made?
Well, it's at the individual level and the collective level. Individually, people who are unable to obtain vaccine because of barriers that might exist in their personal circumstances, or are hesitant or unwilling to receive immunization, are at a higher risk of contracting COVID-19. And the Delta variant is more transmissible. It appears also to be more severe, more likely to result in hospitalization. So they carry a much greater risk of becoming a case, of transmitting it to other household members, to people close to them in their lives, to coworkers. And beyond that, we do need to get to a very high coverage rate if we are to achieve herd immunity and have stability such that we can avoid or greatly reduce the risk of future waves of COVID-19. So really, for those who are hesitant to receive immunization, it's a dual risk. It's for them, and it's a risk for us all.
Thank you. And I know that optimism seems to be the name of the game lately, and no disrespect to the health unit, of course, but has any thought turned to when the health unit may cease public COVID updates altogether?
We are looking at reducing the frequency of these and looking to the potential for it perhaps at the end of the summer is the way that we're thinking now. But of course, that'll all depend on what actually happens.
Thank you for your time.
Mary Beth Hartle from Muskoka Region, do you have a question today?
No, actually, I don't. Thank you so much.
Can we go to James Bowler from Cogeco? Do you have a question today? We'll move to Mark Claremont from Muskoka today. Do you have a question?
Yes, thank you very much, Kara. Dr. Gardner, you spoke about the Moderna shipments coming certainly into Ontario. Do you know whether that's going to translate more on the grassroots level? I'm sort of hearing a lot of people saying that pharmacies aren't getting them.
So according to the projections that we were provided by the province, this week we will be receiving some 20,000 doses to our area of Moderna on top of the 30,000 doses of Pfizer that we will receive to this area, to be provided through all channels, us as a health unit at our clinics, primary care, and pharmacies.
Okay, thanks very much. And I actually did get my second vaccine yesterday in Gravenhurst. They had extras left over from a youth clinic. They didn't book enough people there. On your council job, could you just elaborate quickly about what your role is going to be, and will you have a little bit more influence with decisions in the province?
Congratulations on your second dose. I'm very happy to hear that that worked for you.
Thanks.
And we seek to optimize all opportunities such as that one. So as the chair of the Council of Medical Officers of Health, for which I will be playing that role for the next year. And actually, it's something that I did for a year in 2007, 2008 as well. Essentially, I'm playing a chair role, facilitating the will of the group, the will of the medical officers of health, and identifying with them some key priorities for public health and working to champion those, forming connections with others at the province or other partners such as the Ontario Medical Association, certainly other professionals in public health, and doing a fair amount of communicating as well, whether it's in writing or media work, but speaking on behalf of the medical officers of health as a whole and not merely my health unit in Simcoe, Muskoka. Whether or not it would give more influence, my role is for the will of the entirety of the medical officers of health as a group. So there would not be any particular local advantage to this. It would really be for the benefit for all.
But you're not changing the tone or anything like that. You're not a stronger advocate on behalf of the council members.
I intend to be a strong advocate for the council members and for all that we do. As a council, I would have to clarify when I speak which hat I'm wearing. So primarily here and now, I'm wearing the hat of the medical officer of health for Simcoe, Muskoka, whereas of the other times in which I'd be addressing the media as the chair of the Council of MOHs.
Thank you.
You're welcome.
Can we go over to the phone lines? Are there any questions today?
Hi there, it's Adrienne with MyFam. Actually, all my questions have been answered so far. Thank you.
Thanks so much, Adrian. Is there anyone that has not had the opportunity to ask their question today?
Hi, Martin Halleck, my Muskoka Now.
Go ahead, Martin.
All right. And so earlier, Dr. Garden, you mentioned that system capacity and lab testing are currently in green and everything else is in yellow. Do you expect a move to green in the near future? And if so, when?
I do expect a move in the near future, given the trend, and it could very well be as early as next week. We shall see.
All right. No follow-up. Thank you very much.
You're welcome.
Are there any other questions that we could answer today?
Hey, Kara, I'd like to ask one more question.
Certainly. Go ahead, Mark.
So the Dr. Gardner, you said holding off to for 12 weeks. Does that strictly apply to AstraZeneca? The potency, I guess you'd call it, is more effective after 12 weeks. Does that apply also to Moderna's or any other vaccine by waiting if you can?
It primarily applies to AstraZeneca, but there is some research suggesting that with the mRNA vaccines, you can get a higher immune titer, as we call it, level of antibodies by waiting longer as well. So that has worked in favor, that particular advantage, to the Canadian strategy of having waited for second doses. That may or may not equate to a higher efficacy, but you have a very high efficacy already with the mRNA vaccines in the range of 94%.
Good. Thank you very much.
You're welcome.
Well, I believe that brings us to the end of our media briefing today. Thank you so much, Dr. Gardner, and thank you to the media for your participation. Our next media briefing is planned for Tuesday, June 22nd at 2 p.m.
Thank you, everybody. Have a good day.
Yep, thanks.
Thank you.